Hi friends, welcome back to my channel. Today we are going to discuss about the case note of Ms. Susan Mathew. When we look at this case note, we can understand that it is a small letter and its symbol. So let's see what are the informations which is provided in this case notes. First of all, the patient name is Susan Mathew. The date of birth is 12 December 1999. So to whom we are going to write, or who is our reader? So we have to go to the writing task. Write a discharge summary to Miss Marilyn, charge nurse, Bunbury General Rehabilitation Center, explaining the situation and needs of the patient. So this is our reader or the recipient who is going to receive this letter. So first of all, when we get a letter, what we have to do? You have to analyze or interpret what all the informations, and from those informations we have to select the relevant and semi-relevant information. Then what is the next task? The selected information we have to transform as a letter. These all little information they have given, but we have to make it in a grammatically written letter. So after transformation, we have to review. Is there any grammatical mistakes or the subject verb agreement like that, or any gender change, any spelling mistake or the tense? Everything we have to review, then we have to amend it. If any mistake has happened, we can take at least 5 minutes to review, or the what we call the proofreading. That is very important in a letter. Okay, so let's see what are the relevant informations here. The name and age is important. Then the social history. She is a first year fine arts student, only child, father living and working on his farm, mother is working as a clerk. So this one is important. Then the admission date and the discharge date. The presenting complaint. A&E means accident and emergency. Otherwise in our country we are calling emergency department. So patient did not present at accident and emergency until 27/7/19. That means the patient came to A&E on 27/7/19. They are just using different ways to explain the information or to distract us also. So we have to focus when we are reading. At which time she presented with the signs of peritonitis and shock with a fever of 37.7 degrees Celsius. Then the diagnosis is ruptured appendix and peritonitis. Then what is the medical history? Patient received adenodectomy in 2015. That means patient had adenodectomy in 2015. Denies smoking, drugs or alcohol use. So it doesn't need to inform the charge nurse she had adenodectomy before, because it's not related each other. Then presented with abdominal pain, anorexia, nausea, vomiting, fever. Pain started in right lower abdomen, then related to left and upper abdomen. Tenderness, blood report showed increased WBC, X-ray abdomen, ultrasonogram abdomen, urine test started on IV fluids. Ampicillin 500 mg 6 hourly for 5 days and gentamicin 80 mg BD for 3 days. An emergency laparotomy was performed, appendectomy done. Nil orally for first 24 hours, IV fluid, ciprofloxacin 200 mg BD for 3 days. Post-operative started. Patient transferred to post-surgical unit after the operation. Then what is the discharge plan? Monitor for fever, abdominal pain and low BP. Contact Dr. Brown Smith in an emergency. Patient to be discharged on 4/8/2019. She should present at Bunbury General Rehabilitation Center. Write a discharge summary to accompany the patient. So when the patient will be discharged and going there, this discharge summary will have to be accompanied. So that's why we are making a discharge summary. So this is a simple letter. So let's see an example letter here. Okay. So our receiver is Miss Merlin, charge nurse, Bunbury General Rehabilitation Center. Then the date is 4 August 2019. So dear Miss Merlin, reference Miss Susan Mathew, date of birth told December 1999. Then how we can write an introduction? Anyhow, we are referring to them. This is a discharge and it's a refer letter. She's going there. So we can write, I am writing to refer Miss Susan Mathew, who is recovering from an appendectomy, because they have already done the appendectomy. So we can inform that one. She is recovering from an appendectomy. She requires further care and management following her discharge today. Then the next paragraph we can start with Miss Mathew, a first year fine arts student, because that is the only social history. We don't want to make another paragraph only for that one. So we can write like that. Miss Mathew, a first year fine arts student, presented to the accident and emergency department on 27 July 2019 due to, because it's already diagnosed as the appendix and appendicitis, ruptured appendix and peritonitis, and already the surgery has performed. So we can write like that. Due to definitive symptoms of peritonitis, it is mentioned here, no, this patient, see which time she presented with the signs of peritonitis and shock. So we can write due to definitive symptoms of peritonitis along with shock. Then what are the assessment done? On assessment, her temperature was 37.7 degrees Celsius. Then next paragraph we can write, a series of investigations were performed, because see we don't want to mention one by one, we can just write like that, which revealed ruptured appendix and peritonitis. Therefore, an emergency laparotomy was performed and the appendix was removed. That is means appendectomy. Postoperatively, she was treated with intravenous fluids and antibiotics. Or even you can mention the antibiotic name, ciprofloxacin 200 mg. Twice daily for 3 days postoperative period. But it's already how many days? It's already treated. That's why you can just mention the antibiotics, namely ciprofloxacin, like that we can write, no problem. Then what is the other information? Then there is the discharge plan, the recommendation. Considering the above, or in view of the above information, it would be appreciated if you could observe the condition of Miss Mathew. Please monitor for fever, abdominal pain and low blood pressure. Kindly contact Dr. Brown-Smith in case of an emergency. Then closing sentence, please do not hesitate to contact me if you have any questions regarding Miss Mathew. Then yours sincerely, registered nurse, because it's not mentioned anywhere like that you are a head nurse or charge nurse like that. That's why we can use registered nurse. I think it was an effective explanation for this letter, and you find it beneficial for you. Please like and share my channel, and also if you did not subscribe yet, please subscribe my channel so you can get more videos when I am uploading new videos. Okay, thank you, bye.